Hi everyone, we're back again tonight. Tonight's topic is going to be on stillbirth. And this may be a very difficult topic to discuss and to hear about, but it is a real topic that does need to be talked about and be concerned about. Stillbirth is the death of your baby after 20 weeks up until the time that your baby is born. Now, there are a number of reasons that can cause this. They're generally due to pregnancy complications and labor complications. And there are things that happen before the 24 weeks that can cause stillbirth and things that can happen from 24 weeks on. So let's look at them, okay? Prior to 24 weeks, preterm labor can be the cause of stillbirth. Twins or triplets can cause stillbirth. The separation of the placenta from the wall of the uterus, that's called placental abruptio, and that usually comes with pain. That can cause stillbirth. And these are things that generally happen before 24 weeks. And this information is coming from a report from the Stillbirth Collaborative Research Network. Things that can cause stillbirth from 24 weeks on are placental problems, problems where the placenta is not getting enough oxygen, fetal growth problems and birth defects, so fetal genetic defects, okay? Where there is infection in the person who's pregnant, infection in the womb itself, infection in the placenta, these can also cause stillbirth. Problems with the umbilical cord can cause stillbirth. High blood pressure disorders, medical problems during pregnancy, all of these things can cause stillbirth. I want to talk about something that I shared with women that I cared for in regard to the placenta. The placenta is what I would say is your baby's lifeline. Anything happened to the placenta and it can cause problems for your baby. And also the placenta is an organ that has kind of an age limit. It's not meant to be healthy forever and ever. As your pregnancy goes on, then the ability of the placenta to provide oxygen to your baby decreases a bit because the placenta can age and it's doing its normal process during pregnancy. So things that I would encourage my moms to do is to begin keeping what's called a kick count of their baby's movements starting at around 28 weeks. And what that does is to help us to be reassured that baby is doing okay. And with that kick count, what you would do is once a day, every day, you would count your baby's kicks. And you would want to get generally 10 kicks within an hour, okay? You want to do this when the baby is normally most active. Mothers can tell you when their babies are active and when they're not. They know, they feel their babies, they know. And so you want to do this kick count when the baby is normally most active. There is an app called Count the Kicks that I would recommend highly to you, and it helps you to be able to count the baby's kicks and for you to then be able to measure how much your baby is moving and also the strength of the kicks. So, and then you would take this information into your provider each visit that you have from 28 weeks on. If you start to notice that it begins to take longer for your baby to give 10 kicks, then it may be an indication that the placenta is not getting as much oxygen. It also, if the baby's movements begin to be less strong than what they had been before, and it is, do not compare this pregnancy with a previous pregnancy because every baby is different, but compare the movements to what your baby has been feeling like, and how many kicks the baby has been doing. So what would happen if you were to have some concerns about your baby's movements? I would want you to be encouraged that a lot can happen to make sure that all is fine with your baby. Would recommend that you go in. Do not wait until the next day. Go in so that you're able to have peace of mind knowing that your baby is going to be okay. When you go into your provider, they will do what is called put the baby onto the fetal monitor, and they can monitor how your baby is doing and look at the baby's kicks, what's called a non-stress test. And if all is okay, then they can send you home, and then you can rest well. Everyone can rest well knowing that all is okay. The worst case scenario is needing to have a cesarean section if your baby is not doing well. And so it's best to know about that, to think about, okay, the worst thing that could happen is a cesarean section, and then with all hopes of having a healthy baby afterwards, all right? When I have worked with moms who have had a fetal death, what they have said to me is that they noticed a change in their baby's kicks. And sometimes they did not want to say anything. They did not want to believe what they were feeling, that the baby was not moving as much. But they knew that, they could sense that, they knew what was happening. But they were fearful to say something about it. I would encourage you to most definitely say something about it so that you can be seen and can be evaluated. What's very interesting to know is that for non-Hispanic Black women, the causes of stillbirth mainly are infection and complications that can happen during pregnancy and during labor. Most Black women had problems with stillbirth either in labor and delivery or prior to 24 weeks. And this, again, is according to the Stillbirth Collaborative Research Network. They also found that stillbirth was higher among women who were experiencing major financial, emotional, partner-related, or traumatic events in the year prior to having their baby, which means during their pregnancy. And Black women were found to be more likely to have experienced 3 of these things in the year prior to having their baby. So this is something to be very, very aware of. Again, the summary that I want to give you at the end of this video is it is possible for stillbirth to happen. There are some things that you can do to try to help alert to this, such as keeping counts of your baby's kicks every day, starting around 28 weeks. You may even start earlier if you wish to do so. Knowing that you're counting your baby's kicks and being able to report if your baby is not moving as much or the movements are not as strong. What will happen is to have you come in, have what's called a non-stress test where you're able to see how the baby does when baby moves or kicks. And also the worst case scenario, cesarean section would happen to, if your baby is sick and not doing well, a cesarean section would be done. The other key thing to say is to not wait until the next day. If you're having concerns, let your provider know right away. Go in and be checked. I hope this information is helpful to you. Again, I would ask you to share this information with others who are your friends, your girlfriends, with your family, with your mom, dad, sisters, brothers, aunts, uncles, cousins, and also to share this with other women who you know about. Talk in your family about whether or not anyone has experienced stillbirth and what was that. It is a difficult time for families. and you will more than likely have a period of grieving once you have experienced stillbirth. And so I just want to bring this information. This is some of the real side of things that can occur during pregnancy. And also to feel free, you must feel that you can contact your provider and go in and be seen immediately. This is an immediate kind of thing. All right? So thanks again. I hope this information was helpful to you, and I look forward to being with you again. Have a good night. Thank you. Bye-bye.